So I'm going to look to you, Representative Baker, because of your service on the Health and Human Services Committee there. And I know I ran into you at the legislature. You were working on, I think there might have been an opioid bill that you were working on at that time.
Yes.
But maybe you could bring our viewers up to speed on kind of what the challenges are in that area, what you think might happen, and maybe talk a little bit about the opioid legislation.
You know, out of the House, we have a 1,200-page 12-pound bill that came out. I think it's the biggest, but we always have to throw it out there because it's a big one. But I'm not saying that it's wrong because there's a lot of issues to deal with. We have so many people that are aging in our population. We've got mental health issues that I'm really fighting hard for. And I'll just spin it over to the addiction side of things. Actually, tomorrow morning, we are trying to wrap up our conference committee on this opioid cutting-edge bill that, again, Senator Rosen and Representative Olson have kind of led us for a while in this discussion. Yesterday, I was at Hazelden, Betty Ford Clinic here in Plymouth, and we got to meet Dr. Adams, the U.S. Surgeon General, was in town. We talked in depth about roundtable conversations about how are we going to get this figured out, and he was impressed with Minnesota's bill idea that we have kind of this advisory group coming in. We are going to reform the way we charge pharmaceutical companies doing business in Minnesota, selling opioids. We're bringing in an extra $20 million a year, and we're going to make it go into not the general fund, but it's going into a separate addiction stewardship fund. And this group of advisors and this advisory council is going to tell us how do we spend our money. And he was so impressed with, we have a conduit in Minnesota that is better than most that he has seen. Everybody does different projects on this opioid crisis around the country. We've got people doing cool stuff a mile away, but they're doing another cool stuff another mile away that we don't even know what they're doing. We've got to better coordinate these efforts because it takes a lot of work to get people the help they need and the hope that they deserve. But we have a lot of great tools now with treatment and medicine to keep people sober and in good recovery. So I'm excited about where that's going, and I hope that within the next 3-4 days, we're going to have a bill coming out of both bodies and signed by the governor by the end of this session. It's going to be one of the first in the country. So there's a lot going on in HHS, Barry, and I'm really proud to be on that committee. It's been a lot of work, and I give all of our members a lot of credit for trying to figure out how do we bring down the cost of health care. And it's one of the biggest challenges I've been working on since I arrived here 5 years ago, because there are forces out there that are taking as much as they can. And we have to, unfortunately, tell them they can't do that anymore. And I think a pharmaceutical benefit manager bill we dealt with today is going to start to address those kind of issues.
Representative Eklund?
Well, I got a personal story about the opioid issue. And I had 2 minor surgeries last summer. I had them 3 weeks apart. And the reason I had them 3 weeks apart is because I'm a tightwad. I only want to do 1 pre-op physical. So but the 2 surgeons didn't know each other. One, I had my knee scoped, and then the other one was I had a lump taken off my back. Well, they gave me 2 prescriptions within 3 weeks, 2 30-day supplies of hydrocodone. And somehow we got to figure out how to get these different medical facilities to talk to each other so they know what's going on. Because I said, no, I don't want the second prescription. I took the first one, didn't take any out of that. I didn't need another 30-day supply. So I think that's one of the issues that we may need to address down the road is how we can get our medical folks to be talking to each other so they know that. Because, like I said, these 2 surgeons didn't know each other. They're in 2 different towns.
And part of the issue there, Rob, is that we have that system already set up. It's called the Prescription Monitoring Program. The doctor, anytime they prescribe any opioids to anybody, they should just look on that system really quick. They would have seen that, oh, Rob, I see you got 30 hydrocodone 30 days ago. It doesn't matter what doctor did it or what system they're in. And if the doctors would have been doing that, they would have checked on that. You would have had a conversation with them. You would not have gotten a double prescription. Sure. Well, and so now you're either going to take them or you're not going to take them. Now you've got to dispose of them properly. Yep. And so the systems are there, but we've got providers out there that are just not kind of checking all these avenues because we've learned so much that opioids have made great progress in medicine, and it's important to have it in medicine, but it makes a lot of people sick. It makes a lot of people addicted, and they didn't know that. And so what those docs should be doing is checking the prescription monitoring program. It's all right there because it's required by law that your dispensing pharmacy puts it in there, and they know that Robert Eklund up in International Falls got this from this doc. It's right there, and it takes 30 seconds to look it up.
It's probably why my surgeon had kind of a funny look on his face. So I told him I didn't want the prescription.
I suppose. So, anyway.
Senator, your thoughts on Health and Human Services and related topics?
What I hear most often from people in my area are CCAP, TEFRA, and Spend Down. And I know that
Tell our viewers what those things are.
Well, I wish I could. I once spent 3 hours learning about TEFRA, and I walked out not sure. Well, the CCAP provides funding for low-wage working families so that their children can have adequate child care while they work. There's been some fraud issues with that that came to light here not too long ago. And I know there are some changes that are being made. The thing that I was very concerned about and talked to Senator Housley, because she had the bill, was we don't want to punish the children. We don't want to punish the children for maybe what adults are doing. And I was glad to see she took an amendment that I had, and that was good. TEFRA is for families that have children that are disabled, and they are in some type of a program getting assistance. And based upon the parent's income, they have to make a monthly contribution, shall we say, to those services, the child. And in many cases, what this means is that that one of the parents perhaps doesn't work because it's more economically feasible for them to stay home, because if they were making more money, they would have to contribute more, and it just takes a huge burden on the family. And so I know that Senator Abler in the Senate, Senator Hoffman, those are two champions, if you will, that are working on that issue, both those issues. And we hope to see some changes in those two areas, for sure.
Senator Root, Health and Human Services.
Well, I'll go back to the opioids for a minute. You know, I think we're going at it in every manner we can, because we know it's such a big issue that encompasses a lot of different things. But so my own industry, the real estate industry, we are doing like an awareness program, because when we list a house and we have an open house, it's very easy for someone to come in and look at the house, and while the realtor is busy showing the house, the other person is up in the medicine cabinet going and seeing if there's any drugs there. And so when we list a house now, we talk to the seller and say, go through your medicine cabinet and dispose of the drugs properly. We have great programs all over the state, even in rural areas, where you can bring your medications to the sheriff or the police. And so we're trying to go at that direction too, and just saying, go to your medicine cabinet and go dispose of them. And my husband and I just sold our house last Labor Day, and we went through our medicine cabinet and were shocked, because there's one from the dentist and one from when I broke my arm, and you don't throw them away. You just...
Because you might need them someday.
Yeah, and you just tuck them away, and they're like 10 years old, but,
I know.
You know, so we threw all ours away. And the other thing we asked people to do is then, when they were showing their homes, to take their medications out that they are using now, take them out of their medicine cabinets, take them with them when they leave the house, so that they're not in the house. There's no temptation there. And so I think there's a lot of different ways we're addressing this problem, and a lot of different industries that are bringing awareness. I know the dentist industry, dentists are working very hard to not prescribe so much medication. And I think Walmart, I know in Wisconsin, has started a program where they only fill 7 days. And that's it. And then after, they'll fill 7 days, and then you have to have the doctor re-prescribe. And so I think that's a great program too. So we just, any way we can tackle this problem, I think helps us.
And to be clear too, this is 7 days on a first prescription. We don't want to, people that are in cancer or palliative care, we want to make sure that we're not trying to take anything away from them and making it harder for them. But for the people that use an opioid for the very first time, they need to know that if you are still in pain after 7 days, and it's 3 days after a tooth is pulled, there's something else going on there. And we just don't want to keep masking it with pain pills. Because after 20 days or so, your body becomes dependent. Doesn't mean you're addicted, but your body just needs it. And so we have learned so much about this. And again, it's unfortunate because so many people have lost loved ones, and that's why.